Why is it that in diseases like tuberculosis, HIV, cancers, etc., despite having normal iron stores, patients end up having anemia? In this video, we look at anemia of chronic inflammation, where iron is present but it is unavailable for production of RBCs. This can happen in any chronic disease like tuberculosis, HIV, osteomyelitis, etc. Cancers like lung cancer, breast cancer, etc., or in autoimmune diseases like rheumatoid arthritis, inflammatory bowel disease, etc. What is the mechanism by which iron becomes unavailable in anemia of chronic inflammation? In all inflammatory conditions, interleukin 6 is increased, which stimulates the production of hepcidin. And as we had seen in the previous videos, hepcidin inhibits and sort of destroys ferroportin. For us to understand why this mechanism makes body iron unavailable to be used for hemoglobin production, we need to look at iron metabolism in the body. As we have seen previously, iron is absorbed from the duodenum. Iron from the duodenum is absorbed into the enterocyte. But for this iron to enter into blood circulation, it needs a portal called ferroportin. Iron from the enterocyte travels through ferroportin and reaches the circulation. Here it is attached to transferrin, which transfers iron to bone marrow, liver, and other places. And within the bone marrow, iron is stored inside macrophages as ferritin. And just like in the enterocyte, iron requires ferroportin to get out of the macrophages also. But when hepcidin inhibits ferroportin, iron gets stuck inside the macrophages. This is the basic reason why iron is unavailable for use in anemia of chronic inflammation. Now, along with this mechanism, inflammation also inhibits erythropoietin. So, when erythropoietin is reduced, naturally RBC production from the bone marrow reduces. So, because of increased hepcidin and destruction of ferroportin along with reduced erythropoietin, anemia occurs. But why is it that body prevents iron release into the circulation? It is thought that it is a protective mechanism. Why? Because not only humans but even bacteria require iron for their survival. So when iron availability reduces, bacteria cannot survive inside the body. So it's a protective mechanism against infections. Along with that, hepcidin is a part of a family of defensins which are secreted when infection occurs in the body. So it's probably a natural adaptation against infections. Now let's look at the lab findings in anemia of chronic inflammation. Since iron is not released, serum iron reduces. But Since the storage of iron is increased, serum ferritin increases. And since iron is stored inside the bone marrow iron increases. Total iron binding capacity, which is the capacity for transferrin to bind to iron, reduces because transferrin concentration also reduces, as it's sort of a negative marker of inflammation. Exact opposite of iron deficiency anemia. And when you do peripheral blood smear, mostly you will see normal sized RBCs with normal hemoglobinization. But sometimes you get small sized RBCs with less hemoglobin because of reduced availability of iron. So you get normocytic normochromic anemia or microcytic hypochromic anemia. Anemia is usually mild in anemia of chronic inflammation. Clinically, here the symptoms of the underlying disease predominates and you get mild anemia. And treatment is treatment of the underlying disease. Some patients do benefit from a little bit of erythropoietin. Now let's look at some important differences between iron deficiency anemia and anemia of chronic inflammation. Ferritin is markedly reduced in iron deficiency anemia because iron stores are almost empty. Whereas in anemia of chronic inflammation, ferritin is usually increased because iron is present in the body but it's just unavailable and is stuck in its stores. Total iron binding capacity increases markedly in iron deficiency anemia because transferrin is almost empty and it wants to attach to more and more iron. While in anemia of chronic disease, since transferrin itself goes down, TIBC reduces. Third is bone marrow iron. Obviously, in iron deficiency anemia, it is reduced, and in anemia of chronic inflammation, since there is a lot of iron in the bone marrow, it is increased. So, to wrap up, anemia of chronic inflammation is not due to iron deficiency, but it is due to iron sequestration or iron getting locked up inside its stores. In the next video, we'll look at megaloblastic anemia. Think at the cell level.